So one of the things that comes to mind when you talk about patient experience, or you talk about telemedicine, these terms or practices that have kind of been around for several decades. The other one that comes to mind is interoperability. We've been talking about this word for a long time. I think a whole stage at the recent ViVE conference completely dedicated to ongoing interoperability conversations. And so just kind of help us understand, are we really any closer? Are we even having 10% improvement in interoperability? And what are some of the challenges that we're still facing there?
Yeah, I haven't thought about a percentage, Dr. Roxy. I think we've probably seen a 10% improvement. We have seen improvement. There's a lot of governmental pressure, and it's unfortunate when it requires governmental pressure, but sometimes it does. And so there's been some acts, as you know, and policy changes that encourage those companies that haven't been willing to share their data very easily, forcing them. But yeah, some of the challenges still historically and today are the cost, right? So these companies that do this, it's almost, it's almost copy and paste, but they still charge an inordinate amount to the customer, and the customer can't afford it. So you still see that dichotomy happening. And then there's still this reluctancy. I mean, again, there's sort of some vendors are sort of forced, not all vendors, a lot of vendors are really cool about it. And so you don't get the seamless experience. We'll talk about, patient experience should be seamless and frictionless, but it only can be that if there's interoperability. And so I still think we have a ways to go. Yeah, the discussion, you're right about at ViVE. Like if you take that panel, and you can have that same panel 20 years ago, we can talk about it. But again, on the optimistic side, we are making improvements. I just think we got to keep pressuring each other, holding ourselves accountable to one another, and ultimately never forget the patient, right? We both know that very near and dear, that if we keep the patient-centered focus, I think we'll all do the right thing.